So good morning, good afternoon, good evening, everyone. Welcome to the event about the FIP Development Goal 16 on communicable diseases. That is part of the series of digital events about the FIP development goals. This development goal is very important and very timely, and we wish you a very good event. Today, my name is Ruben Viegas, and today I'll be your facilitator. I'm the FIP Practice Development Projects Coordinator, and I'll be here together with Gonçalo Sousa Pinto, who is the FIP Lead for Practice Development and Transformation, which I will hand over in a minute, just after a few house rules. So this webinar is being recorded and live streamed via Facebook, so you can follow it there as well. The recording will be available on the website at fip.org. So if you could not stay for the whole event, or if you wish to share, you can also find it there. You may ask the questions using the Q&A box. Please try to use this box for the questions, otherwise it might get lost in the chat box with the general comments. If you wish to provide feedback, you can write to webinars@fip.org. And lastly, to become a member of FIP, you can visit fip.org membership registration. And with this, I hand over to Gonçalo.
Thank you very much, Ruben, and good morning and a good day to all. As Ruben was mentioning, this event is part of a comprehensive program of events focusing on the 21 FIP development goals. The series is called Setting Goals for the Decade Ahead, and that's precisely what we aim to achieve with these 21 events that will cover each of the goals throughout the year in 2021. The main outcome of these events is really to mobilize global pharmacy development and transformation by using these goals as a framework, and the idea is precisely to unpack and to present each of the elements that make up the goals and the mechanisms behind them and the priorities behind each of the goals. By engaging our profession and our member organizations and colleagues around the world, we will provide a description and a direction and context for each specific goal. And we do hope that this is valuable to you to identify, to use this framework of development goals to identify the needs and priorities within your country, within your jurisdiction. The goals will also be used as a tool to monitor and evaluate progress against each of the development goals over time through data collection and through a series of indicators that can be used to not only to identify the priorities, but to assess the impact of our profession in the areas of practice, science, as well as workforce and education. The 21 events will happen throughout the year. We started in March, at the end of March, with Equity and Equality, Goal 10, and we will have 2 events per month. This is the 3rd episode in this series, except for September, as you can see, will be a busier month because we have World Pharmacy Week during that month, and we will have 4 events at that time. Next slide, please. And the FIP development goals really are respond to the one FIP philosophy that exploring the synergies and the unity between the 3 elements of practice, workforce, and education, as well as pharmaceutical sciences. And it really functions as a 3-legged stool that you can't have one without the other. So they mutually support each other and are essential for each other. You cannot have pharmaceutical care without a solid scientific foundation and without the workforce development and education that can contribute to developing the competency to deliver those services in pharmacy practice. Next slide, please. And these are the 21 goals. You will be sharing with you a brief video where they are presented one by one, so I will not go into detail on this slide. But you may remember that these goals developed from the initial workforce development goals that used to be the first 13, and then they were expanded to 21 to cover different areas. And not only they were expanded to 21, but also under each of them, not only the workforce dimension is covered, but also practice and science. Next slide, please. Yeah, we'll now watch the video. Thank you. Thank you. So the expected outcomes of today's event will include to describe the development goal 16 and explain the components, the workforce and education, science and practice, but also to showcase some of the publications, tools, evidence and other resources that FIP has developed over the years and that are currently available to you to contribute to advancing the profession in these three dimensions in relation to Development Goal 16 and communicable disease. We'll also have a panel of experts that will help us identify priorities across practice, science, and workforce and education within the area of communicable diseases. And we will engage with you all and our member organizations, as well as all attendees, in an activity to support monitoring the evaluation of the goal by developing a set of indicators. Next slide, please. So we have, as you can see, we have been translating the goals, and there's a publication that is available to you all that describes the goals in further detail. And we are translating the goals into several languages, and we'll start with 6 United Nations languages that you see on the screen. But should you be able and have the possibility of collaborating with FIP in translating the goals into other languages, we'll much appreciate your collaboration. So do get in touch with us. As I mentioned, each of the goals has 3 elements and components, and for Development Goal 16, with regards to workforce, the key element or description of the component under this goal is that every country and every jurisdiction should have the education and training infrastructures in place to develop a workforce that is prepared to deliver quality services around communicable and vector-borne diseases. In the area of practice, the goal is that each country would have the strategies and people-centered professional services for the prevention, surveillance, management, and therapeutic optimization of communicable and vector-borne diseases. And within the science element, The goal is that each country or each jurisdiction would have the capacity to monitor and respond to communicable diseases with innovative approaches for prevention and treatment. And you may be wondering that when we show the calendar of events throughout the year, that they were not in numerical order. So this is because we have identified key moments throughout the year that are particularly linked to our development goals. And this week, and there's two main reasons why we have selected this week to have a focus on communicable diseases and Development Goal 16. You may know that we are in the middle of World Immunization Week from 24th to the 30th of April, with a campaign that was launched by WHO with the theme of Vaccines Bring Us Closer. And as per WHO, the key message of this campaign is that vaccination connects us to people, goals, and moments that matter to us most, helping improve the health of everyone, everywhere, throughout life. And you may know that WHO organizes and marks throughout the year a series of health awareness days, but vaccination is so high on the global health agenda as a priority that every year WHO dedicates a full week of activities to raise awareness and drive action to improve vaccination coverage around the world. So this year, this is the theme, and we align with this campaign by organizing this event and other activities throughout the week. Also, you may know that in December 2020, WHO launched the Immunization Agenda 2030 that sets the global strategy for the next decade in terms of goals in vaccination. And this is a very dear document to us and to which FIP contributed as well. And it places a special focus on leaving no one behind and really promoting vaccination throughout life, from early ages until older adults. At every age, each person should have access to the vaccines and vaccination services that are appropriate to their condition and their age. Next slide, please. And during this World Immunization Week, we are also launching and presenting together with our partners in the Immunization for All Ages Coalition, an updated manifesto on promoting immunization throughout life. This manifesto highlights the need for countries and governments to invest in disease prevention and ensuring that everyone has access to the vaccines they need across life. And this Immunization for All Ages Manifesto coalition is an initiative that is supported by Pfizer and brings together several civil society organizations that share the common priority of improving vaccination coverage around the world. So FIP is there, but you can see the logos that we're joined by the International Federation on Aging, the World Federation of Public Health Associations, the Confederation of Meningitis Organizations, the International Longevity Centre UK, and the Shot at Life advocacy organization. And we will be presenting this manifesto today with some video messages, not only from the FIP president, but also from Dr. Jane Barrett, Secretary General of the International Federation on Aging, who will be sharing some further details about this manifesto. You may also access the manifesto on the FIP website, specifically on the transformingvaccination.fip.org website, and you can also access it directly by scanning the QR code on your screen. So without further ado, I would ask Ruben to start the video message from the FIP President, Dominique Jourdain.
Dear colleagues, this year's World Immunization Week, ending tomorrow, has the theme Vaccines Bring Us Closer. After more than a year of the COVID-19 pandemic, we have all experienced lockdowns and social distancing. The new coronavirus has not only taken over 3 million lives around the world, but it also forced us into isolation. We have not been able to meet our families, friends and colleagues, and we have not been able to get together face to face for our congresses and meetings. We now have several vaccines at our disposal, and it is essential to join efforts to ensure access to vaccinations to all. This is as true for COVID-19 as it is for the 26 other diseases for which there are safe and effective vaccines. We need to ensure that every single individual has access to the vaccines that are appropriate to their age and health condition throughout the life course, leaving no one behind. This is why FIP is proud to be a member of the Immunization for All Ages initiative. This is a coalition of organizations with different constituencies and missions, but with a common goal of increasing vaccination coverage across all ages. In addition to FIP, the coalition includes the Confederation of Meningitis Organizations, the International Federation on Aging, the International Longevity Centre UK, the Shot at Life United Nations Foundation Initiative, and the World Federation of Public Health Associations. The IFAA is kindly funded by Pfizer. As pharmacists, we can play a crucial role in expanding vaccination pathways through our pharmacies. Pharmacies can offer a well-trained health workforce and highly accessible premises located at the hearts of communities to facilitate access to vaccination services across all ages, and especially for adults and older adults. This is essential to protect people not only from the infectious diseases vaccines directly prevent, but also to protect people living with non-communicable diseases from their condition worsening. All the health professions need to join efforts as vaccination providers so we can drive vaccination coverage rates in all countries. As the IFAA manifesto states, we must strive to eliminate the requirement for a medical prescription for vaccine administration when clear eligibility criteria and protocols have been developed for each vaccine. We must also ensure equity of access to vaccines and vaccination services by eliminating the need for out-of-pocket payments and ensuring appropriate remuneration models for all vaccination providers. As president of FIP, I reiterate the commitment of a readiness of the pharmacy profession to join forces with colleagues in other health professions to improve vaccination coverage and contribute to bringing this pandemic to an end. Thank you.
Thank you very much. And we now have a brief video message also from Dr. Jane Barrett on behalf of the partners on the Immunization for All Ages initiative and the International Federation on Aging.
Leadership can be transformative in policy when sectors and disciplines come together with a common agenda and a clear purpose. The International Federation on Aging is very pleased to be part of the Immunisation for All Ages initiative, which is working to combat inequity, improve immunisation to promote health, to preserve function, and to prevent disability and death. Together with the World Federation of Public Health Associations, the International Pharmaceutical Federation, the Confederation of Meningitis Organisations, Shot at Life, and the International Longevity Centre UK, this initiative, which is supported by Pfizer, has three main calls for action. The first, prioritise immunisation as a key pillar to expanded prevention strategies and a central component to universal health coverage. Second, reduce barriers to safe and accessible immunisation for all. And thirdly, to reduce inequity through timely, affordable immunisation. The pandemic has brutally exposed the life and death consequences of infectious diseases, and particularly for older people and those most vulnerable. As we move into World Immunisation Week with the theme Vaccines Bring Us Closer, action is required from the global community, which has been brought to its knees by the COVID-19 pandemic. Now more than ever is the time to ensure that we protect the progress made in immunisation, but moreover respond to significant gaps that have come to light through targeted education, the rapid expansion of vaccinated pathways, including that of pharmacists as vaccinators, and truly act on the issue of ending immunisation inequity. The roadmap for policy change is set with the UN Decade of Healthy Ageing, the Immunisation Agenda 2030, Gavi Phase 5, and the Global Roadmap to Defeat Meningitis. It is time that together we work. We walk the talk, and we ensure that all countries have a comprehensive immunisation plan so that no person is left behind.
Thank you very much. And there's a second reason why we are hosting this event this week, and that's also because in addition to World Immunization Week, we have just come from celebrating or marking the World Malaria Day on the 25th of April, just last Sunday. This day, the campaign that was launched by the World Health Organization for this day as well, that had the motto of reaching the zero malaria target, and really malaria and other vector-borne diseases are responsible for killing millions of people around the world every year, and they demand our full attention as healthcare professionals. And we believe that pharmacists have a particular role to play in their prevention and management. And our event today will also have a part focusing on the role of pharmacists in vector-borne diseases. Next slide, please. So we come to our panel of speakers after this introduction and the launch of the manifesto. Today we will have, I must say that we have utterly failed in having a gender balanced panel today. But I'm sure you will agree with us that the expertise of our four speakers today will surely contribute to a rich presentation and debate afterwards. Our first speaker will be Professor Ian Bates, who is Director of the FIP Workforce Development Hub. Ian is Chair of the Pharmacy Education at the UCL School of Pharmacy in London as Head of Educational Development. He's also Editor-in-Chief of the Pharmacy Education Journal, an international research journal hosted by FIP, which has been publishing peer-reviewed educational research continuously since 2000. And Ian is also a fellow of the FIP and of the Royal Pharmaceutical Society, the Royal Statistical Society, and a trustee for the European Pharmaceutical Students Association, EPSA. I will introduce all four speakers and then just give them the floor directly before their presentations. Our second speaker, focusing on the element of practice, will be Mr. Lars-Åke Söderlund, who is president of the FIP Community Pharmacies section. Lars-Åke has an extensive experience of working together with the Swedish healthcare sector in improving health and creating a sustainable healthcare system. He has been vice president of the Swedish Pharmaceutical Society and has had a number of executive positions within Apoteket AB, recently as head of national customers and new businesses. Lars-Åke is president for the Swedish national project Check My Medicines, and he's also co-chair of the FIP Congress Program Committee, as well as president of CPS, as I mentioned. He's a frequent speaker in Sweden and internationally regarding the future of healthcare and pharmacy. Thank you very much, Lars-Åke. Our third speaker will be Dr. Eduardo Savio, who is president of the Pharmaceutical Forum of the Americas. Dr. Savio served as the chair of the FIP Policy Committee on Antimicrobial Resistance in 2018 and has served in different FIP capacities and positions, including vice president in the FIP Bureau. He's currently is president of the Pharmaceutical Forum of the Americas and has been internationally active with more than 150 presentations in international conferences. He is head of Nuclear Pharmacy Department at the Uruguayan Center of Molecular Imaging and a member of the director board of this institution. He has also been an expert at the International Atomic Energy Agency in several countries worldwide in the fields of radiopharmacy and radiation security, and performed as a professor and academic director of the Hospital Pharmacy Specialization Masters at the University of the Republic in Uruguay. And lastly, we have Dr. Cameron Phillips from Australia. Dr. Cameron Phillips is an academic in the College of Medicine and Public Health and a senior pharmacist at Flinders Medical Centre and research lead with the Southern Adelaide Pharmacy Department at the local health network. His research interests involve health services research, optimizing the use of antimicrobials, the quality use of medicines and knowledge translation. Dr. Phillips has held visiting researcher positions at the National Institute for Health Research, Health Protection Research Unit in Healthcare-Associated Infections and Antimicrobial Resistance at the Imperial College in London, the Department of Medicine at the University of Cambridge, and Public Health England. He has a strong interest in the education and development of registered health practitioners in the clinical environment. Dr. Phillips currently holds a statutory appointment from the Ministerial Council as a board member on the Pharmacy Board of Australia. So thank you very much to all four speakers, and I now give the floor to Professor Ian Bates for his presentation. Thank you, Ian.
Thank you very much, Gonzo, and I'm looking forward to hearing my colleagues present a whole and very broad picture of where we're going with this particular development goal, goal number 16, communicable diseases. Of course, as the next slide shows, these goals do stand alone, but they also are formatted or integrated into a holistic or a systematic framework of global development goals. For example, on the next slide, this goal number 16 has very clear educational and training links with antimicrobial stewardship and a very clear link with clinical pharmacy, with people-centered care, focused pharmaceutical services delivery. So it's not entirely living on its own. And in terms of workforce development, then clearly early career training strategies, so young pharmacists, foundation training for pharmacists, and also the development of specialists in care, pharmaceutical care, are also going to be clearly linked with this general focus on communicable diseases. So I'm really saying in a way that the 21 FIP development goals are systematic and they are integrated. And although we can have these focus on the individual ones, I think the best way to view them is to look at the representation of the whole developmental spectrum that they represent for our profession, at least for the next 10 years. Moving on, I've got two very simple and straightforward messages to deliver this morning. My colleagues are going to be dissecting and explaining the full scope of communicable disease from the various sectors, and also the, if you like, the holistic impact. I've got two clear things to say about initial education and training and what we need to do for the current active workforce. And these two messages I admit, are very sharpened at the moment by the current global pandemic that we're in, but they do represent a longer term strategic mission that we need to fulfill for our initial education and training and for our continued workforce development. Let's start with our future, which of course is our students who are learning about pharmacy in their initial education and training. Even now, as the next slide shows, in the midst of our global pandemic, the preparedness of our students is not what we would like it to be. What we really want is 100% on both of these diagrams here, rather than some no's and some maybes as quite high proportions. My thanks here to the International Pharmaceutical Federation for a recent global survey that they conducted on preparedness of our current pharmacy students. So we want 100% in terms of vaccination, skills training, immunization, knowledge and understanding. Remember, it's not just COVID we're talking about, as we'll see later on. It's a whole range of communicable and vector-borne diseases. But immunization now is a key public health message, of course. So we clearly need to do better right now. So the next slide shows us that there is a wider context as well. We are reacting as a global community right at the minute, but the broader context for communicable disease and vector-borne disease as a whole lies in the Astana Declaration, the WHO Astana Declaration, which is, of course, about population access to primary healthcare via our profession. So communicable disease lies within a more holistic spectrum of the science behind medicines, vaccinations, the use of medicines for communicable disease, and of course, a whole range of overlapping features to do with the use of antibiotics, antibiotic stewardship in our community practice. So Astana and primary healthcare are a broader based context, but we still have some gaps within that, which we need to fill at our initial education and training routes, as we have seen over the last year, for sure. There are some important, if you like, collateral spin-offs of focusing or a greater focus on initial education and training, and they sort of relate in my head to the interprofessional opportunities that arise, working and learning with young medical students and graduates, young nursing students and graduates, and our young pharmacy students and graduates as well, sharing that best educational practice. So I think there is something for our universities to look at in terms of the mode, the modality of initial education and training for communicable disease, immunization, and medicines for communicable disease. Through our academic institutional membership and FIP education, we are tackling these issues and advocating for these issues. And FIP is playing a key role in many regions across the globe now. Next slide. Part of the broader context, which I think is important to bring up, is the science does include competences and skills, as well as that cognitive understanding of medicines, the breadth of medicines for communicable disease. In addition to, we have this current focus on vaccination right now, but in addition to that, all health professionals and pharmacy in particular needs to ensure that we've got that broad range of life support skills, cardiopulmonary resuscitation, basic life support, and what to do with adverse reactions such as allergic responses and such like. So there is, this broader range of skills, if you like, which need to be going to it, which our medical colleagues take for granted. They embed it everywhere in their professional journey. We should be thinking about that and doing that ourselves as well, as pharmacies become an important focus for accessing primary healthcare with our ever increasing populations, our aging populations who are, of course, comorbid and taking many more medicines for many more comorbidities, including communicable disease. So that's the broad context within which we are working, and initial education and training really does need to have a refocus, I think, on that. And we need to ensure we do have some harmonization globally about what we have in our curricula to enable this to gradually build into the future workforce. The student perspective is very clear. Can we have more of this, please? And can we make sure that we are ready to be those immunization providers in our communities? That's what they're asking for, and quite rightly so. Next slide, please. But we also have, and this is the second half of my message, the active workforce, and we have some clear gaps to fill. I think over the course of the last year, hundreds of thousands probably of pharmacists have been upskilled and trained to be providing vaccinations in response to the global pandemic. This now needs to become the norm, and CPD programs need to ensure that we have regular updates on communicable disease as a whole, immunization specifically. We still know that there is variance regarding the regulatory and the mandatory aspects of training, skills training, competency training. That broader science base as well also needs a good look, as my colleagues later on will make reference to. The science of immunization, the science of vaccines, the science of medicines has moved on quite tremendously recently. And our CPD needs to move on with it as well. One element I'm very keen on, which we've learned from our previous work about developing ongoing workforce competency-based training, is training the trainers and making sure that every country, every leadership body, all of our members are working on training the trainers so that we have an active cadre of people, skilled and expert pharmacists who are able to deliver this as a CPD issue for our active workforce. So I said I would not be long with my two principal messages, and I'm going to keep to that promise, but there are some important background issues going on which I'd like to bring to your attention. The next slide, I'm hoping, shows one of them, which is an imminent launch of a WHO developed global framework for competencies for universal health coverage. So we're back to Astana and our primary healthcare mission. FIP has actively contributed to this major development. And what WHO is trying to do is to, and ourselves, has been to work out throughout the whole spectrum of the healthcare professions, from community health workers all the way through to nurses and physiotherapists, pharmacists, dentists, physicians. What are the universal competencies needed to provide universal health coverage? And of course, vaccination and immunization and public health is a part of that spectrum of competencies which all our key health workers need. And certainly we will be aligning our FIP global competency framework, that scope of practice framework, to make sure that we are covering these universal health competencies. And we will be actively promoting this and pushing this as a major global policy initiative. It's not hard. It's not rocket science what we're talking about here. It's just being persistent to make sure that we have these things embedded in our initial education and training and embedded in our continued professional development throughout our careers, no matter which sector we're working in. I'm strongly urging FIP, and that there is no resistance to this at all, but I'm strongly urging a structural framework, if you like, a manual for bringing together all the elements that we need to ensure that with communicable disease, immunization in particular, that we have all the elements in place to make sure that we have that career-long pathway of upskilling embedded in all nations, with all our member organizations fully supported in that. Moving on, this idea about framework and guidelines linked with these competencies can be done using this adopt and adapt principle. Many nations and member organizations are already on the case with education and training in terms of immunization. Adopt and adapt, we have shown, and WHO supports us in this, but we have shown that this is the right way forward. Not reinventing wheels, but at the same time, not telling people what to do, but adopting and adapting those elements of education and training, particularly competency-based elements of education and training that we know work, okay? And that's a key message from me right now. I do believe I'm coming up to my final slide in my very simplistic approach, and the key takeaways on the next slide, please, Ruben. So the key takeaways are that it's clear we need common goals and outcomes, and we're close to achieving that. I think we can all agree on what these common goals and outcomes are, from initial education and training all the way through into workforce development. So let's have these competences as a routine component of initial education and training. Not something that's special, but a routine thing. We all do it. And the expectation there is that we all do it, so that this no longer becomes a workforce issue in the future. Every graduate is skilled in conducting immunization services, from actually jabbing people, of course, all the way through to understanding public health messages, public health advocacy, and all the science that goes behind that. So our support from FIP needs to be global, it needs to be strategic, it needs to be accessible, and I think in particular, making sure that our low and middle income countries and our members from those low and middle income countries have that wrapping of support that comes from being a member of this very influential global leadership body called FIP. So that's me done. I'm really now looking forward to hearing my colleagues start to expand on this broader landscape of communicable disease and our major role in it. Thank you for listening.
Thank you very much, Ian. We'll now move directly into the presentation by Lars-Åke Söderlund. Thank you very much. The floor is yours.
Thank you so much, Gonzalo, and thank you, Ian, for a very nice introduction to the development goal number 16 and the future of profession and setting the scene. I will briefly go through the practice part of the development goal and look also deeper into some communicable diseases where the role of the pharmacist is very clear and contributes a lot. So when it comes to the practice part, it's about having strategies and people-centered professional services for the prevention, surveillance, management, and the therapeutic optimization of the communicable diseases and vector-borne diseases as well. And regarding the mechanisms, we need to develop and implement structured and evidence-based disease prevention strategies and professional services for vector-borne and communicable diseases by all types of different etiological agents. And we need to develop and implement structures and mechanisms to contribute to the overall integrated prevention health strategies. We need to engage with different stakeholders and policymakers to implement strategies and policies that support the delivery of vaccines by the pharmaceutical workforce, as Ian also mentioned. And this is a very highly relevant topic today in the whole world. And of course, we need to develop and implement clear and comprehensive strategies on readiness for dealing with and delivering urgent and emergency pharmaceutical care and services during pandemics, epidemics, and disease outbreaks. And here we all have the ongoing pandemic in mind. And we need to develop and utilize tools, resources, and expertise to educate patients and caregivers in an appropriate and timely manner on communicable diseases and vector-borne diseases, including sexual health education in the context of preventing sexually transmitted diseases. So from this, it's also very clear to understand that pharmacy needs to be part of a national health strategy with clear objectives and goals. Next slide, please. Overall, we can say that community pharmacists have an important role in fighting communicable diseases. And as you can see in this slide, there are a number of areas where community pharmacists are already involved, such as prevention, control of vectors, administration of vaccines or delivering vaccinations, which is very actual these days, and perhaps the most important intervention against communicable diseases. Furthermore, education of the public, participation in national campaigns, follow-up of therapy or medicines optimization could be against specific vectors or preventive treatment, but also for other therapies as well. And of course, recommendations for preventive therapy to infected areas, education about preventive actions, and preparation of insect repellents, but also regarding travel medicine with services, advice, as well as products when going to a specific area. This is an important and also growing area of pharmacy practice. Next slide, please. Vaccination is the main action in preventive strategies against communicable diseases. And there are many reasons for this, of course. I would like to highlight that preventable diseases such as influenza continue to kill too many people each year. And we have the ongoing pandemic as well. And vaccination rates needs to be higher than they are. And patients want access to healthcare at a time and in a place that suits them from a trusted healthcare professional like the pharmacist. And pharmacists are also the most accessible healthcare professional because pharmacists are the nearest local healthcare facility within primary healthcare, and people trust their local pharmacist. So it's important to improve vaccine access and uptake, and health systems must fully involve pharmacists in their vaccination strategies. Because we are accessible, we have extended opening hours, especially during the last year when others are closed. We have the ability to identify high-risk patients easily based upon their medications. And of course, people trust pharmacies, and the public is also very enthusiastic about the role we play in the countries where we actually vaccinate. And of course, we are a knowledgeable vaccine resource, and we have lots of education and training in the countries where we do provide vaccinations, and we have also the ability to handle storage issues. It's also important to make sure that vaccinations are offered over the life course, and immunization is actually the best buy perhaps in global health and has a crucial role in achieving 14 of the 17 different sustainable development goals identified by the United Nations. And as one of the most far-reaching health interventions, it closely reflects the ethos of the Sustainable Development Goals, leaving no one behind. Next slide, please. So here is one example. When it comes to COVID-19, community pharmacists' scope of practice has been widening during the pandemic, with more patients seeking care from pharmacists and more pharmacies anticipating increased point-of-care testing and expanded immunization services. So community pharmacies are an essential service and have remained open during the pandemic to provide care to patients. And local pharmacies are often the initial place many patients call or visit when they are not feeling well. So pharmacist-patient interactions have increased during the pandemic, which presents an opportunity for community pharmacists to further impact patient care. We can also provide accurate and real-time information on COVID-19, and we have a direct role in combating misinformation and helping patients understand the evidence for various treatments. We can, by the increased interactions, allow also patients to actually be recommended a vaccine, and we can conduct point-of-care testing if available. So a number of different services have been implemented during the pandemic, such as telepharmacy, remote counseling, e-prescriptions, and home delivery or curbside pickup of medicines that will ensure adherence with prescribed therapies for those who can't visit the pharmacy. So the increased availability of virtual and telephone consultations is also very useful, of course, especially for those vulnerable populations who are sheltering in place. And of course, testing in pharmacies and vaccination against COVID-19, as well as increased collaboration with other healthcare professionals, are important developments. Next slide, please. Well, here we can see some examples of how community pharmacists are providing more and more vaccinations to prevent COVID-19. And in many other countries as well, pharmacists are administering the vaccines and in collaboration with different healthcare professionals. So let's look at another example. Next slide, please. So let's look at HIV and AIDS as an example. So regarding HIV and AIDS, pharmacists have developed a clear role over the years, for example, in antiretroviral therapy. We can, in some countries, diagnose all patients with HIV as soon as possible, as we are a part of a national or regional healthcare facility where we actually can serve as a testing center or testing venue. We can treat patients with antiretroviral therapy rapidly and effectively to reach sustained viral suppression. We can prevent new HIV transmissions by using proven interventions, including syringe services programs, and of course, respond quickly to potential HIV outbreaks to get needed prevention and treatment services to the people who need them. So in many countries, pharmacists are part of the HIV/AIDS team, and pharmacists' involvement in the care of HIV-positive patients has been associated with improved patient outcomes, including enhanced adherence, reduced pill burden and dosing frequency, higher rates of viral suppression, and decreases in medication errors. So this has indeed contributed to increased survival. And another example is, next slide, please, tuberculosis. Tuberculosis every year kill more than 2 million people annually. And every year, more than 9 million new cases of tuberculosis occur. So nearly 500,000 cases have the multi-drug resistant form of the disease, which is actually a very serious problem. So community pharmacists in many countries are directly involved every day in the fight against tuberculosis. FIP has signed an agreement with the WHO regarding the fight of tuberculosis, and the overall aim is to have a joint stewardship in developing policy guidance and collaboration activities, to undertake orientation and training for pharmacists, care and control of the tuberculosis patient, and to promote the rational use of anti-tuberculosis medicines and ensure that quality assured medicines are used. We have a dialogue with the healthcare providers to rationalize and strengthen the tuberculosis management practices. And we have systems for referral of chest symptomatic cases to primary healthcare. And of course, provision and monitoring of DOT treatment. DOT is directly observed treatment, short course. That means that the patient actually swallowed the pill or the medicine at the pharmacy under supervision from the pharmacist. So as such, pharmacists in many countries have a key role in the rational use of antibiotics, part of national campaigns, awareness programs in school, and public education and communications campaigns. So I would stress in this case the importance of enhancing treatment success and contributing to preventing the emergence of drug resistance, which is a serious problem, and reducing defaults and to cut the disease's transmission. Next slide, please. And finally, antimicrobial resistance. It is not a communicable disease, but it is directly linked to communicable diseases, as antimicrobial resistance means that we will have fewer effective treatments against these diseases. And this will be highlighted and explored in depth at another of the development goals events in November 2021. So by this, I think I will finish my part of the presentation, Gonzalo.
Excellent, thank you so much, Lars-Åke. And without further ado, as we are running a little bit behind schedule, I ask Eduardo to, I give the floor to Eduardo for his presentation. Thank you very much.
Good morning. It's a pleasure to participate of this seminar. Next, please. Okay. I am the president of the Forum of the Americas, and we have been working in the regions in this area of vector-borne diseases. Vector-borne diseases account for more than 70% of all infectious disease worldwide and cause more than 700 deaths per year. We know that the changes that are about climate changes is also having a great incidence of the distribution of how vector-borne disease is moving and affects the global distributions. The clear example is the pandemic that we are living, and it's also affected for a variables of factors that we have to take into account as commerce, as how people travel and how we are connected worldwide. This kind of disease also produce great suffering, long-term mobility and disability and stigmatization with associated distress and mental health problems. And also a third important key factor that we have to take into account is that affect in middle and low country, those part of the population that has less resources. We have a reference publication from the WHO that is from 2014, and that I recommend to have into account as a starting material to read about this kind of diseases. Vector-borne diseases can be caused by different causes as parasites, bacteria, or viruses, and the main ones are malaria or dengue, the most prevalent ones. Malaria is a parasitic infection that causes more than 218 million cases worldwide. And then here we can see the distributions that is mainly in those countries with high temperatures. On the other side, dengue, which is provoked by a mosquito, is the most common viral infections. And this mosquito corresponds to the classified as arbovirus. We have 3 arbovirus infections. The main one is dengue, but we have also Zika and chikungunya. And this is an estimated 100 million symptomatic case and about 40,000 deaths per year. Also, we can see the distribution is worldwide and the vector is disseminated along the world. The next slide, please. As I have mentioned, other vector-borne diseases include chikungunya fever, Zika virus fever, but also yellow fever, West Nile fever, Japanese encephalitis, and tick-borne encephalitis. There are Other virus-borne diseases, less common, but they have also incidence in public health as Chagas disease, leishmaniasis, schistosomiasis, which affect hundreds of millions of people worldwide. There are several measures that could be taken. One of them are to use protective clothes, and there are protective measures, and also community awareness, as Lars Oxide mentioned, is one of important instruments that community pharmacists can work on. Next, please. So, in order to emphasize our role in prevention, a key actions in this kind of diseases is working on vector control. There are many measures, and this is the most important actions, together with vaccinations. Not all these diseases have vaccines, but in case that they have, for example, in dengue, some years ago, has been approved an effective vaccine for dengue. And so it's a very important issue that from community pharmacists, it can work. Also, in case that in some specific vector-borne diseases, it exists, preventive medicines to work, to be capacitated with training, and to work with the public how to take the better profit of these medicines. The personal protection techniques and the education. We have been engaged in our regions, working in community educations. We have developed a toolkit that has been customized in each country to the belief of the populations. And also this is to improve community participation and engagement, which is also a key issue. And besides this, hygienic practice is a very important issue, how people have access to potable water, how have access to suitable food management, and basic hygienic practices. Next, please. So, pharmacy's role is for the prevention and management of vector-borne disease. We know that we are ideally positioned for the preventions. We have in the regions developed a technical document. This was 3 years ago and was supported by the FIP Foundation for Education and Research, and it was elaborated by Dr. Cristina Fernandez. It is available in the forum's website, this technical document of the pharmacist's role in prevention, detection, controls of the arbovirosis infection, and it's focused in 3 arboviroses, dengue, Zika, and chikungunya, and yellow fever also. Then specific national countries has taken this information as has translated to the specific needs of the country, and we can see a specific educational sheet in order to work with our patients that comes to the pharmacy. So we are ideally positioned for the prevention and for the management, and this includes awareness raising campaigns that has to be regularly developed each year. We have to participate in advice, we have to educate on vector controls and disease prevention methods, which are very effective and are one of the main barriers to this disease. Also, as Lars has fully explained, vaccine administration and promotion of vaccinations. We have a lot of work to develop in order to optimize the treatment. And besides this, in case there is not enough supply from the industrial repellents, it can be elaborated in the pharmacy. Next, please. To address these problems, FIP has already organized this schedule. The first one has taken place last Wednesday, 21st, in the Americas, and was coordinated by Gonzalo. I would like to also thanks the people who, Dr. Nuria Montero and Cristina Fernandez, who participated of this. And the next one are for the Africa, Eastern Mediterranean, Western Pacific, Southern Asia, and Europe, monthly starting on June. And the last one will finish on September. So FIP is organizing this series of events to socialize what the materials, the kits, and the elements, and the priority actions in each of the 6 WHO regions in collaboration with each regional pharmaceutical forums. I invite you to participate of these events. Next, please. So the links between vector-borne disease and FIP development goals can be focused on different ones. It has been fully explained the broad spectrum that the objective of 16 communicable disease, but we also have as goal number 7, that is advances in integrating services, and also people-centered integrated health service provisions based in interprofessional is something very important, because vector-borne disease cannot only be addressed by pharmacists. We can also see an opportunity to develop in national campaigns to work together with other professionals. And also, as I have mentioned, the number 10, equity and equality. This is a kind of disease that affects mainly in middle and poor countries and those parts of the populations that have scarce financial resources. It's an opportunity also to measure the impact and the outcomes, performing all the prevention actions as well as intervention actions. We have the opportunity to work on continuous programs developments, and so to have our updated capacity in order to advise medicine expertise. It's also an opportunity to work in goal number 17, antimicrobial stewardship, in using the proper use of medicines that applies to vector-borne diseases. And finally, it's an opportunity to develop center patients services and having access to medicines, devices and services, and working with the goal number 18. Next, please. Finally, in November 2020, a handbook for pharmacists that address this important issue of vector-borne disease has been published, and it will, soon as this has been done in collaboration with the Pharmaceutical Forum of America. I would like to thank Gonzalo and Dr. Nuria Montero that they have worked very hard, and it's a very interesting reference book to go deeper in the knowledge of vector-borne disease, to know how, which is the role that pharmacists could perform in this area. And so it's a very important contribution to this area. Next one. Okay, thank you very much, Gonzalo.
Thank you, Eduardo. Thank you very much. Without further ado, I will give the floor to our final speaker, Dr. Cameron Phillips. Cameron, thank you very much. I will start by introducing the first slide. Next slide, please. As with the other elements under Development Goal 16, the science element also includes a few mechanisms that have been defined and agreed upon to structure the work or to guide the implementation of Development Goal 16. And these include facilitating the information sharing about disease prevalence and innovative treatment strategies, conducting an inventory and disseminate educational programs and tools to accelerate innovative, preventive and treatment strategies, and monitor the development of innovative diagnostic, preventative and therapeutic pharmaceutical products. And Cameron will now present some of the priorities within the science dimension or element of Development Goal 16. Thank you very much, Cameron. The floor is yours.
Thank you very much, Gonzalo. It's a pleasure to be here. If we can have the next slide, please. I just wanted to just give a brief overview and say that, what it might seem very basic, but communicable diseases or infectious diseases are spread from one person or an animal to another in a vector. Next slide, please. And you can categorize them obviously in a number of different ways. Here in this instance, we have bloodborne diseases, gastrointestinal diseases, other bacterial diseases, sexually transmitted infections, vector-borne diseases, which we've just heard such a lovely presentation on, vaccine preventable diseases, and zoonotic diseases. I've highlighted vector-borne diseases and vaccine preventable diseases because FIP has done a tremendous amount of work in that space and continues to do as well. Next slide, please. Now, this is just a snapshot of current vaccines that we have for communicable diseases, and it's by no means exhaustive. But, you know, I think we have to ask ourselves the question, whilst we have a considerable arsenal, are we doing the best we can to vaccinate those in the regions that we come from with what we existingly have? And the answer is we're not. We look forward to the statement, the report, sort of the WHO Immunisation Agenda 2030 global strategy to leave no one behind. It's a very important document, and we look forward to working to that. Next slide, please. So in thinking about the science element, we need to be heavily influenced by data. So we need to monitor. We need to monitor the epidemiological data on the prevalence of communicable diseases. This may involve us contributing to data capture or sharing of data. So, you know, whether pharmacy associations, member organizations, large pharmacies, networks of pharmacies, or very small pharmacies, we all keep records. Where those records are informative, can we leverage that data? Inventory data on stock, patients treated, deliveries not fulfilled, drugs shortages, patients with comorbid communicable diseases, patients who have TB, HIV, sexually transmitted diseases, malaria. Can this change the way we treat and improve outcomes for our patients? We need to monitor the distribution of vaccines and pharmaceuticals by region. Equity is a very important point here, and we are witnessing right now with the pandemic about the production, the distribution, the access to COVID-19 vaccines, that equity is there, that is not there rather. And communicable diseases experts will tell you that we will see more pandemics in the future. And we don't know the frequency, but we can guarantee that will occur. So how we deal with this now and moving forward may shape the way for subsequent responses to pandemics. So this is a critical juncture here, and it will be it may define how we move forward in the future. So we need to, when we respond in thinking about the science element, we need to do this in a data-informed way. So we need to use the data to inform the pharmaceutical needs of the countries and the regions for communicable diseases. We need to identify barriers that impact on pharmaceutical prevention and treatment of communicable diseases. And where barriers are identified, we need to engage with governments, NGOs, civil societies, other entities to facilitate pharmaceutical manufacture, distribution, and ultimately supply to our patients. So, for example, some of you may know that there is no mRNA production facility in the Southern Hemisphere. And there are not enough production facilities on the planet at the moment for our needs. Just last week, one of the state governments in Australia, the Victorian government, announced that they will be building a mRNA facility, which will enable the first vaccines to be coming off production line in 12 months. So the announcement of something like this comes from multiple avenues creating something like this facility to occur. And coming back to equity and supply, the production capacity is very important. And what we'll see with what we're seeing now with the what we're witnessing in India, with the travesty that it's unfolding, the Oxford AstraZeneca vaccine, a very large proportion of doses on the planet produced of that are being manufactured in India. And some of you may have seen even just recent news reports in the last 24 hours that with this circumstance in India, the production of the AstraZeneca vaccine will be reduced, and thus the targets for supply around in many places around the world will be bumped forward, and meaning that, you know, we don't have enough supply and supply is going to be reduced. And this comes back to very, very fundamental questions about pharmaceutical manufacture, having enough workforce, having enough facility, and then of course the distribution networks, the pathways to ensure that we can get our supply to our patients in the regions that we serve. Next slide, please. So we need to innovate, and we also need to get better at adopting validated technologies to assist with diagnosis. We heard a little bit earlier about point-of-care diagnostics. These are just a few, but point-of-care diagnostics can be relatively low cost in compared to costs associated with pathology laboratories, and they can effect rapid treatment once you have a rapid diagnosis. So these are exceedingly helpful in terms of using our scientific means to achieve our objectives. There are some challenges with the sensitivity and the specificity of these diagnostic tests. However, as I mentioned, some of them have been validated multiple times over, and they are still extremely useful. Next slide, please. So in future monitoring, we need to do this for new diagnostics in the development and novel or preventative therapeutic pharmaceutical products, and technology for communicable diseases. And so talk about a technology, for example, there are sensors which are being developed at this time. And so you can have a sensor which will be a little bit larger than, say, a coin, a monetary coin. And you take that sensor and you attach it subcutaneously to the inside of your arm. And that might last for, say, 2 weeks. And that can tell you the concentration of an antibiotic that is in your blood. So an example might be someone may have an infection and require drugs such as vancomycin, which typically you want to do therapeutic drug monitoring on. However, that of course requires a laboratory, it requires instrumentation, it requires assay, it requires calibration, and that's a lot of resource. Now, this point of care, these sort of sensors that I'm referring to, they're in development for antimicrobials. Once they come about, this will be very, very helpful, and will be a relatively low cost way of monitoring antimicrobials serum levels when required for certain infections. And this is now mainstream technology for glucose monitoring. So what happens is you put the sensor on the inside of your deltoid and you wave a smartphone over it at any time, and it will tell you exactly what your blood glucose levels are. So this is a very interesting technology. So we watch this space. So with education, there's a need to design and disseminate educational programs, and to enable our stakeholders to harness the elements of the Development Goal 16, improving data science skills, innovative prevention and treatment strategies, and the use of existing validated diagnostic technologies. Next slide, please. So FIP is a community. It's wide and far-reaching across the globe, and of course our different regions carry different burdens of communicable disease, and there is not, a one-size approach for all our regions. However, the FIP development goals provide initiatives which can be adopted to suit the country or the regional requirements that we are serving. Thank you.
Thank you very much, Cameron, and all the speakers for the excellent presentations and outlining the priorities and developments related to communicable diseases and the FIP Development Goal number 16. As you may have seen, we are running a little bit behind schedule, and I don't think we will have time to address questions. We haven't received any so far through the Q&A tool, but I do invite our attendees to send any questions via that tool so that we can log those questions and address them after the webinar by email if you wish. So without further ado, I will just provide an overview of FIP's initiatives aligned with Development Goal 16. And if I can have so very briefly, we have mapped some of the project by our constituencies in the area of communicable diseases. For example, there's a project led by the Board of Pharmaceutical Practice in the area, and specifically the community pharmacy section in the area of travel medicine that Lars-Åke also mentioned in his presentation. And by the regional forums present in the various regions of WHO. We have the Pharmaceutical Forum, the Americas, that is prioritizing immunization services with training activities and the production of technical documents. And also from the Western Pacific Pharmaceutical Forum, a survey focusing on the impact of COVID-19 on pharmacists in the Western Pacific region, of course. Next slide, please. And I think I will now hand the floor to Ruben, who will present some of the resources that FIP has developed in this area, including some novelties. Thank you, Ruben.
Thank you, Gonçalo. So just a brief overview on the publications. The first one Dr. Eduardo already spoke about is the Vector-Borne Handbook, which was a collaboration with the Pharmaceutical Forum of the Americas. This publication is openly accessible, and it has a lot of information. It's very comprehensive on the different vector-borne diseases, and as well on things that pharmacists can support, such as prevention of management of such diseases. As of today, it's also available in French, Spanish, and Portuguese, which also covers most of the countries where these diseases are more common. Going on, there's also the Advocacy Toolkit that was launched in 2019. This one is a publication exclusively for FIP member organizations and aims to provide support on expanding immunization coverage through pharmacies. So it's how can more advocacy work can be done at the national level in order to advance this practice. And as of today is also available in Spanish. The following publication is called Give It a Shot, which is a shorter version of the previous advocacy toolkit. This one is openly accessible, and it's more of a summary of findings and practical tools that you can also find and use for your work in the national level, and it's also available in Spanish. The next one is there was this survey in 2016, an overview of current pharmacy impact on immunization, this global report that was redone in 2020 and counted with the participation of 99 countries and territories. So it was one of the highest or the highest rate on this type of services. It is openly accessible, and we would like to thank the Turkish Pharmacists Association for the collaboration and translation to Turkish that is now available. Moving on, I would like to present the regulatory self-assessment tool. This one was done in collaboration with the FIP Regulators Forum. This one provides the tool for the regulatory bodies to assess the frameworks that exist in their countries or territories. So the vaccination in pharmacies can also be advanced, but more on a regulatory perspective. This one is also openly accessible on the FIP website, and it's available in English, French, Spanish, and Portuguese. There are some other resources, previous publications, for example, the guidance on Ebola virus disease, and the collaborations with WHO in tuberculosis and HIV/AIDS that you can see on the right side. One very recent information hub is the Kovid Resource Hub that you can find at FIP.org coronavirus, and it has many tools and information about this disease. So it's a separate section dedicated just for COVID-19. As Gonzalo also mentioned before, the Transforming Vaccination event that happened last year, it's also available in a separate microsite where you can find all the events and also the recordings for these events. I will invite you to visit events.fip.org, where you can find all the information about the previous events and also the following ones. And this year, 2021, and next year, 2022, there will be around 40 events focusing on communicable diseases in the areas of vaccination, COVID-19, vector-borne diseases, and also HIV. So please keep up to date. And without further ado, I will pass the word to the FIP Lead Data and Intelligence, Chris John, for a short activity.
Thank you, Ruben. I'm going to spend a few minutes talking about the work of the Global Pharmaceutical Observatory and the monitoring and evaluating of the development goals. Next slide, please. We have, in this webinar, heard Dr. Cameron Phillips stress the importance of data linked to Development Goal 16. And the FIP Global Pharmaceutical Observatory's mission centers around data, intelligence, advocacy, and reporting. We know from the COVID-19 pandemic the importance of data, and for data to provide us with evidence, and for evidence to provide us with intelligence. So our first task is always, and particularly related to today's Development Goal 16, communicable diseases, is to collate valid global data on workforce, education, practice, and pharmaceutical science. We must undertake comprehensive analyses of collated data to provide accessible, high-quality intelligence, and all this must be communicated innovatively to promote our member organisations' impact on health. This communication will often be via the FIP Atlas, which is our visualization platform for displaying our intelligence across the globe. Finally, we will provide evidence-based strategic information, reports, and guidance on the application of pharmaceutical science policies, practices, and services. Next slide, please. You'll see on this slide the FIP Global Pharmaceutical Observatory's outputs and influences. In the interest of time for today, you can see the outputs. The most relevant and important one for today is our tracking of progress against the development goals. So this is particularly important. It brings the development goals to life and helps strengthen health systems. Next slide, please. Current Global Pharmaceutical Observatory actions and projects, again, briefly, we have a multinational education and training needs assessment project running, which is a project and a first global pilot of mapping education and workforce needs against the development goals, using the FIP development goals as a framing device. The main aim of the project is to address multinational needs-based professional development and workforce development for the pharmaceutical workforce across cohort nations. We have also been creating some Atlas dashboards, which is a way of visualizing data, and we will be doing this for Development Goal 16 on communicable diseases. We're developing a website and database for all this data, and we have a Data and Intelligence Commission, which meets regularly to discuss big ticket items that provide assurance and guidance on achieving the GPO vision and mission. Finally, and the reason why we are here today, we have an important project that aims to produce indicators that will measure and monitor progress towards the development goals, which is where you all come in. Next slide, please. So you'll see on the screen now we have a short engagement activity for you. FIP is now seeking to develop indicators and country-level metrics to measure, monitor progress and performance of the implementation of the development goals. So we'd like to seek your support for this Global Indicators and Metrics project by contributing to this brief activity linked to this Development Goal 16. We'd like you to know your opinions about how we measure this. This is a simple tick box exercise. All you need to do is click on the link on the slide at the bottom, or you can use the QR code. And this will take you through a very quick activity, which, as I say, is tick-based and hopefully an enjoyable way of seeing how we can measure the development goals. Next slide, please. And that's back to our moderator. Thank you so much for your time.
Thank you very much, Chris. And I've also shared on the chat box the link to this activity. So we do appreciate, and we'll be sending you also a reminder after the webinar, at the end of webinar, and also tomorrow, if you can kindly collaborate in this collective effort of developing a set of indicators for Development Goal 16. Now would be the moment where we would have our panel discussion, but for the sake of time, we have actually come to the closing time of our webinar. And we haven't actually received questions via the Q&A tool, but feel free to write to us on webinars@fip.org if you have any questions, and we can address them to our speakers by email and get back to you. Next slide, please. So just in conclusion, you can access the publication of the development goals on the link that is on the screen at the moment on the FIP website. You will be able to find it easily. Next slide, please. And just to announce that the next event on this series will focus on the FIP Development Goal 20, dealing with digital health, and that will be on the 12th of May from 2 to 3:30 Central European Summer Time. And I think this brings us to the end of our presentation. I would just finally like to thank our speakers today for the excellent presentations that you delivered, outlining the priorities and the way forward in each of the elements of FIP Development Goal 16. Also thank to Ruben and Chris for presenting our work and our initiatives in this area, and inviting you to participate in this activity to develop together with us and the collective experience around the world a set of development of indicators to monitor progress on the goal on communicable diseases. So thank you all very much, and have a good day. Goodbye.